is in fact advances in both in anesthesia and surgery. Advances in anesthesia and advances in minimal access. And two other things is of course the economic imperative or the economic drive and social impetus. Okay? This is becoming more and more popular among the population, day surgery. That's why the number of day surgeries are increasing by the day in the West. Okay? Because people are quite satisfied with getting their surgery in the day surgery units. Okay? So, just in brief, what are the advances in anesthesia? There are a lot of new drugs like propofol, like we will not be understanding them. Okay, so there are a lot of new techniques. Okay, so that has made day surgery feasible. Okay, previously we had to give general anesthesia. Okay, patient needed rest and all, but nowadays they give local anesthesia, regional anesthesia, and also that people can ambulate and go home as soon as possible. Okay, so due to advances in anesthesia, in drugs, technique, and the very important is what I consider is the philosophy. Okay? After surgery, everybody has pain. Everybody has pain. Now the philosophy nowadays is we just avoid pain, not control. Okay? So we give vigorous anesthesia before surgery itself, so that patient should not complain of pain. That is our philosophy in day surgery. Okay, so we give anesthesia. We give painkillers regularly, 4 hourly or 2 hourly, not as and when needed. Previously, painkillers would be given only when patient said, okay, patient complains of, I have got pain. Then only the painkiller would be administered. Okay, now we know that patient is going to have pain. Okay, why let him have pain? Okay, give him the painkiller earlier before he has pain. Okay, so this is the new philosophy in anesthesia. Previously, after surgery, you think, okay, patient may vomit, so they have to delay feeding. Okay, now the concept is, okay, you feed as soon as possible. Okay, as soon as possible, patient should be fed. Okay, early feeding, and like I have said earlier, early ambulation. Okay, this is the main philosophy of short stage surgery or day surgery. Okay, early ambulation, you try to ambulate the patient as soon as possible. In fact, in some of the centers, they don't have a bed, they just have a chair. Okay, after the surgery, a reclining chair. After the surgery, patient is kept in a chair and not on a bed, in fact. Sorry. So what are the advances in surgery? Okay, so like we have already said, the day surgery has been feasible because of minimal access. The trauma itself of surgery is because of very long scars. Okay, people have pain for prolonged days. Okay, now because of this minimal access means you just make a small hole, okay, to get your surgery done. Okay, because of minimal access, surgery that needed patient to stay in a hospital for 5 or 6 days, they can go home in 5 or 6 hours. Okay. So what do we mean by minimal access? Minimal access means whether a percutaneous, you can get a percutaneous intervention. Percutaneous means you get your things done through a skin. Okay? Through the skin, percutaneous. Other is endoscopic intervention. Endoscope means you put your instrument through all the natural orifices. Okay? Like natural orifices. By natural orifices, I mean like your oral cavity, okay, urethral cavity, okay, the anal cavity. Okay, you can put a scope, okay, through all the natural orifice and get your surgery or your intervention or procedure done. Okay, this is called endoscopic intervention. Okay. Then another is endovascular intervention. Like most of us heard about having a stent done in a cardiac patient. Okay, this is an endovascular intervention. Okay, you can get embolization for your aneurysm. This is endovascular intervention. Okay, and finally I have got written a portoscopic intervention. This term I think you will not find in the dictionary. I searched Google, and this Google said, do you mean proctoscopy? but we just define a portoscopy to give a general term for, okay, for laparoscopy, mediascopy, thoracoscopy, arthroscopy. Laparoscopy means you make a port, a small incision through which you can put your instrument, okay, into the abdomen. So that is called laparoscopy. Okay, if you put your instrument to the mediastinum, we call it a mediastinoscopy. Okay, we put our instrument through a small port and a small incision. That is called a thoracoscopy. If you put the instrument in the thorax. Okay, and arthroscopy means we are putting our instrument inside the joint cavity. Okay, the orthopedic surgeons, okay, do now minimal intervention through a, okay, arthroscopic incision. Okay, so a generic name that we have coined is a portoscopy. Then just saying, okay, what do we do laparoscopy? No, we are not doing only laparoscopy. We are doing portoscopic surgery. Okay, but this term hasn't come out, I think, in the literature as such. Okay, so by portoscopy, what we mean is we are getting to the point where we want to get by making a small port. Okay, by putting a small incision and put our instruments through it. There is no natural orifices to get into that side, because in the abdomen we cannot get to the abdomen through the intestine cavity. Okay, so we are going through a small incision in the abdomen. Okay, so that is a port. So when, okay, so what I said, I think that the sooner we practice it, the better. In fact, discharge on the same day of surgery was practiced way back in 1909 by Nicholas in Scotland. Okay, he had published a paper in British Medical Journal way back in 1909, where he operated upon, in fact, 9,000 children and sent them back home on the same day. He was trying to popularize this thing. Okay. But it really got popular and is gaining in popularity, okay, due to what SAC means standalone centers. That are day surgery, standalone day surgery centers. So this was first done was established in 1970 by Walter Reed in the United States, Arizona. Okay, since then it has become quite popular, and BAT stands for British Association of Day Surgery, was established in 1989. Okay? And there is an International Association of Ambulatory Surgery. The day surgery is also popularly known as ambulatory surgery in the States. Okay? In the continental Europe, they say day surgery. In USA, they tend to say ambulatory surgery. So, the Ambulatory Surgery Association was formed in 1995, and its center is based in Belgium. IADS is Indian Association of Day Surgery. Okay, was established in 2003. Okay. So, Ambulatory Surgery Center Association, so this is in America, was established in 2008. In America, I think there are two centers which was catering to day surgery, and then they merged in 2008. Now they've got one association as Ambulatory Surgery Center Association. Okay, and in Nepal also, we are trying to propagate day surgery or ambulatory surgery, and so we have established Buddha MAI in 2008. Okay? MAI stands for Minimal Access Intervention.